going to have a great session. But I'm actually going to use the first 2 minutes to put in a little plug. July 11th, Friday afternoon at 2:30, we have the H.J. Mehta Oration, which the Alumni Association runs. This time it's one of our alumni from the 1977 batch. Someone from Bangalore itself, Dr. Chittaranjan Andrade, Professor Psychopharmacology at NIMHANS, who's going to give the oration. It's going to be about electrical stimulation of the brain, both anatomical considerations as well as what happens in the real human brain. This is especially that way because the H.J. Mehta Oration, as you probably know, is in memory of H.J. Mehta, who was professor in anatomy in SJMC. So he's actually going to go into the anatomical considerations and then go into the clinical features of electrical stimulation of the brain. So please be there for the oration. It's at 2:30. It goes on till 3:45, followed by tea. Usually tea and food is a good plug, so be there. From here, I'm going to just hand it over to Dr.
Thanks, Maya. Now I'll translate that into English, which is okay. I'm putting a link. She's got this American accent, I have Kati Indian accent. Thank you all for being here. I'm not supposed to be speaking today, I'm only the Vice President. The Career Guidance Secretary is the guy who did all this and got everybody, all this organized. Anthony Robert, he says he's operating, should I? No, I will not say what he's operating on, but he'll be here shortly. We've arranged especially for you guys on a request from you, coming eminent from you, the younger Johnites. And we have a young stud of a Johnite, another guy who's slightly older than him, looks younger than him though. They're both lined up for hair transplantation with me after we finish this talk. They're the best guys. I mean, you all know Nitin. You know, I don't need to introduce William or Nitin to any of you. So without further ado, let's get on to your talk, which is going to be on.
Okay, everyone, good evening. It's good because to see the hall full, because usually when it's in a large auditorium and people come to know I'm speaking, it tends to be empty. So finally I can say I'm speaking to a packed house. So thank you all for coming here, missing the mess, chai and whatever snacks were there today. Okay, so what do you see on the slide right now? Exactly. So this is the state of most of us after we finish internship or during internship when it comes to PG entrance exam. There's absolutely no clue that we had, because we were, our batch was very special in many ways. I mean, most of you know that, but our batch was also in some ways special because we were the first batch who knew that we were going to have NEET, but we didn't know what was going to happen. NEET started the previous year. Until about August, we never even knew whether NEET was going to be the only exam we were going to write, or whether, welcome Anto. He's the very hard-working intern. He was in Medicine Unit 2, worked so hard, got sick and got admitted in Medicine Unit 2 and went Dharma from Medicine Unit 2. So welcome Anto. So anyway, so like I was saying, so like I was saying, we didn't know what was happening and it was a total blank state of mind. But 3 years back, there were no sessions conducted by the Alumni Association for PG entrance exam, and honestly even I felt there was no need to conduct, because the formula for cracking an Indian entrance exam was very simple. You sit and study for 12 hours for about 6 to 7 months, and if the questions that you have read comes, you crack the exam. But things have started changing for the past 2 years, and William and me will be, we have got some celebrities coming here, winners of the Obama Singh Award and all. So anyways, so me and William have experienced quite a few change in the exams, and that is what we'll be trying to address you. To be very frank, the second years who are here, I mean, this talk will give you a bit of more orientation, but frankly I really don't know how much this talk is going to be useful for the second years, because as we know, the Indian government keeps changing things every 2 to 3 years. So if the same thing remains for the next 2 to 3 years, fantastic. Otherwise you'll have to have someone else come and address you again. So very briefly, these are the rough set of exams that anyone applying for the Indian entrance exams would be writing as of now, which would be in May. As soon as you finish internship, in May you would start off with the AIMS and PGI. Actually, you need to start from November, because the only exam which you're eligible to write as an intern is the All India Postgraduate exam, which takes place in November. So that's the only entrance exam which you're eligible to write as an intern. So after that, in May, you have the AIMS and PJ exams which happen. I think May happens in the second Sunday. Yeah, so it's fixed. It's second Sunday of May, and PJ exam will be the third Sunday of May. And in July, August, you will have the DNV session 1. This year it happened in June, followed by November. Now November is the biggest month in the life of anyone writing PG exams, because you have a set of 4 exams and your morale depends on how well you do in these exams by and large. So your AIMS, PGI, I think in November also it follows the same pattern. Second Sunday of November your AIMS, third Sunday you would have PGI, and then you would have the DNB exams generally before the AIPG exam. Now I'll tell you what's the importance of DNB exam being close to AIPG exam when I come to it. January you would have the CMC exam, December, January, and then in February, March again it becomes one of the most important months, because your Comet K, St. John's, JIPMA and other all private college exams, Manipal and other miscellaneous exams. Now if you notice, there's one very important exam missing from this list. Anyone can identify which that is? Okay, AFMC also, I'll tell you why I have not included AFMC and, okay, KSET and AFMC. Now the reasons these two are not included is that from last year, the All India PG exam on NEET rank was used for civilian candidates to get into AFMC. So there's no separate entrance exam for AFMC. So it's your All India rank. And from this year onwards, there's not going to be Karnataka CET exam also. It's going to be your All India rank, which they classify into a state rank, right William? Which they are going to classify into a state rank, which is going to be used for you to get into the government colleges in Karnataka under the Karnataka quota. Now whether a large majority of John's people will be able to even take admission in these colleges is subject to the court's ruling, because this year there was a huge domicile issue. They say that you have to have stayed in Karnataka for 10 years before you are eligible for KSET. Now that order was quashed temporarily for this year's seat selection, but I still believe that few of my batchmates had problem when they went for the counselling, so that remains a tricky issue. But by and large, people who are wanting to get into AFMC also, please remember that you need to do well in your All India score. Okay, so when I tell this slide, many of you are going to go into depression, start going to hyperventilate, maybe want to kill the person sitting next to you or anything. But you can do whatever you want, because we have an emergency medicine PG here, and he'll take care of everything and then admit under medicine, whatever the case may be. Okay, so anyway, so this is the scenario that's there right now. So the NEET exam in November 2014 was written by 90,000 students, out of which 27,000 qualified. Now qualified means you're just eligible to get a rank. So that is 50 percentile. And there are 1,800 seats for general merit among all subjects, and these include, I mean, no disrespect to these subjects, but these include also anatomy, physiology, microbiology, pathology. So it's 1,800 general merit seats for preclinical, paraclinical and clinical subjects. You can do the maths, and these seats are also in places like Assam, Orissa, Meghalaya, Shillong and all. And overall there are roughly around, including all categories, reservations and everything, there are roughly about 4,000 to 4,500 seats. So the criteria of qualifying is basically, they call in a 1:5 ratio. So around 4,000, 4,500 odd, and about 27,000 were qualified this year. So what are the odds? Someone do the maths of getting a good seat in a good government college. So what happened is that the central government came up with this bright idea of one exam for the entire country on one day, and they decided to call it the NEET. Now after almost 2 years of court hearing and all, the court decided to squash NEET. I mean, make it as the only entrance exams, but since a lot of money was invested in it, because it's a computer based exam and all, it was decided that this would replace the traditional All India exam. William, if you can just say a few words about the old All India exam.
I think as far as I remember, I gave one during my internship. It was a 300 mark paper, 3.5 hours, and basically most of the paper comprised of repeats. The concept of repeats that time was very, very popular, in which you just had to study at least 5 to 10 years of repeats just study the question papers, and a good chunk of around 60 to 70% of the paper would come from these questions in itself. So the more number of repeats you do, the higher your chance of securing a mark or a good rank. With some questions being a little intellectually based, not factual, some amount of application coming in there. However, that was still, when I was in internship, that is when 2005 batch gave their exam. 2005 batch gave their exam. Post which is when the NEET concept was introduced. There are two ways of looking at it. One of them was, the number of, what was anticipated out of NEET was it's going to be a more challenging exam in terms of logic based, where application is involved, so that your rote learning goes out of the window, which was what was happening before. However, due to a lot of technical difficulties and the fact that they had to have nearly 28 sessions, because NEET was spanned over 2 weeks, so nearly 28 sessions were there, which meant for them to come up with so many logical questions was going to become really, really difficult. So what they had to do was to ask a lot of these memory-based questions. Okay, so that was the biggest disadvantage which happened there. So initially, it was said getting into an all-India seat was slightly easier because you knew the formula. You knew what you had to do. If you do your all-India books, if you do your AIMS book, you're nearly about there. As much as you go depth into it, the more will your chances of getting in. Now, it's a totally different ballgame. So I'll probably give it back to you now.
Okay, so like William was saying, the NEET exam is done over 7 to 10 days. There are 2 sessions per day. One in the morning, one in the evening. And it's for about 3 hours, 3.5 hours. The previous year it was 240 questions. This year when we wrote, it was 300 questions. So you can imagine that the same people are being judged on different standards and different questions. So now the logic is, suppose I ask Eben, what's the capital of India? Okay, so Eben says New Delhi. But then I ask Anto the same question and ask him what's the capital of Czechoslovakia. Okay, and Anto knows the answer to what's the capital of Czechoslovakia. So the problem that the people who was setting this NEET had was that the person who is answering New Delhi as the capital of India is being given the same mark as the person who is answering what's the capital of Czechoslovakia. So what they decided to do was give different marks for different questions. And you had no idea of knowing which question was tough and which question was right. So if you read the NEET website, which all of us did, on how the scoring system was done, because the first time we wrote as interns, we had no idea as to how our ranks came and what was the score. We just got a random score and none of us knew what it was. So this is what the NEET website states, that it contains of 240, there's a psychometric analysis, there's calculation of raw marks done. So this is all English and it's easy to understand. But the tough part begins from this. They say that the raw marks are equated, the contents are assumed, there's a psychometric process which is done, post-equating is done, then there's a logarithmic analysis which is done, and then the equated raw score is taken. Post-equating takes into account any statistical differences in examination difficulty. So this is what, whenever you write a NEET exam or a DNB exam, this is how they say how your score is going to come. So did any of you understand it? Okay. So this is what happened to all of us who are trying to find out how NEET is done, and that explains the hairline on mine and William's head. So essentially because I was jobless for some point of time, tried to understand it, actually spoke to a statistician when I was working in the research institute, and this is what I understood. So there are going to be 300 questions in your NEET paper. Now each of these questions are going to be divided into, let's say for example, 10 blocks. 10 blocks of 30 each. Okay, so each block has a different difficulty level. So block 1 might carry say 0.5 marks, block 2 might carry 1 mark, block 3 might carry 1.5 marks, and so on. So then based on which questions you answer, you will get that much marks. Now this difficulty is decided by the examiner. But what's difficult for the examiner might not be difficult for the candidates. So what the computer does is that if more than say 60% or 70% of the candidates have answered a difficult question, it downgrades the mark it's allotted. So suppose a question was carrying 5 marks and say 80% of the people have answered it, that question will now carry only 2 marks. Whereas suppose something was thought to be easy and only say 10 people answered it, then that question will carry 5 marks. So this is how the marks are done, and these are calculated into equating marks. Now they compare students in one session. Now suppose me and William have written say today morning session and Rituja and Kushal have written in the evening session. So my marks and William marks are first compared depending on how many difficult marks are added, and suppose we have got, say I've got 200 questions right and William has got 220 right, but I've got more difficult questions right, my score is scaled up to say 350 or 400 and William's is scaled up to say 340. Now Rituja and Kush, our paper had out of 10 blocks, 7 were difficult blocks, whereas when Rituja and Kushal wrote, there were only 4 difficult blocks. So what happens is our marks are going to be scaled up more than theirs. So understood? So this is what happens in NEET, and this is how your marks are given at NEET. So it really depends on the day you write the paper, the difficulty level of the questions, and more importantly, who writes the paper along with you. So how many of you have gone into depression already? Okay, but I mean, I'll come to how to approach this later. So this is what is happening with the current scenario with NEET exam. And remember, there is no point in saying that NEET is in November, JONS is in February, Comet K is in February. I won't study for NEET, I'll study for the JONS and Comet K exam. Because you have no idea at what point of time there's going to be any legislation which states that NEET is the only exam that's going to take place. And remember that NEET is applicable to many institutes all over the country, including AFMC and Karnataka CET. So it's very important to know how to approach NEET. So coming to exactly to how to approach NEET, forget about everything, scoring system and everything. Just remember one thing that stands true till today, and that's something which I realized after the results came also, is that the more number of questions you get right, the more higher is your rank. Irrespective of all this psychometric, it's being video recorded, but there are a lot of expletives that come to my mind when I want to analyze this psychometric system. But forget about all that. Okay, just remember for a fact one thing, that the more number of questions you score right, the more is going to be your rank. It might vary between plus 100, minus 100, but that's the worst possible scenario that can happen, and that's not such a bad thing. So when Lavina, me and Jeffrey wrote on the same day, and we, out of 300 questions, we could recollect almost 280 combined together. So I had scored around 210, 220 questions right, and Lavina had got around 180 to 200 right. So this is just the raw score. And this was also reflected in our ranks at the end of the day, that the more questions you have got, the more is the right answer. There's one wonderful website which William and me will talk about later, which is called rxpgonline.com. Okay, now this is a wonderful website with this a two-edged sword, because there were people, after every day, there are people who are posting their raw scores. And there were some exceptional people who said they were getting 280 right on 300, 295 right on 300, and on some other days they were saying today was a very tough paper, I'm getting only 180 right and all. But at the end of the day, all that was proved to be bogus. The mean score that anyone got from various posts that we saw was around 240, 245. So between 240 to 245 up to 220 if you got, you were within the top 2000 rank. So the theory of getting more number of right answers still holds good. So this is more to the interns and the post-internship batch. NEET, what do you target upon? So before any exam, entrance exam, it's very worthwhile to read the prospectus to know the question distribution. Which subjects, how many questions are approximately expected. Never ever not read the prospectus, because the prospectus gives a lot of clues. So when you look at the NEET brochure, out of 300 questions, at least 60% of the weightage is allotted to the first year, second year subjects and common. So you have 20 to 25 questions from ANAT, the same questions from physio-biochemistry. So that makes it 75. You have about 30 each from Pharmac, Path and Microbio, and you have about 30 questions from common. So the main key, and that is something that helped me also, because I didn't have time enough to finish, not even touch final year subjects before I went in for NEET. But I made sure I covered the first 2 year subjects properly, and that helped. So when you have 150 to 160 questions almost coming from first 2 years and common, for NEET exam, please pay a lot of attention to the first 2 year subjects properly. We'll just come to it later, and what do we mean by paying attention to it. So I'll quickly run through the various different kind of exams, and then we'll throw it open to you and make you ask us questions. So AIIMS, obviously, it's the #1 medical institute. Now this exam has negative marking. Now always know the dates for the exam. It's on the second Sunday of November and second Sunday of May. So you have +1 for the right answer and minus 0.33 for a wrong answer. There are 200 questions. Again here, it's my opinion, I don't know if William has a different opinion on it. I would feel that AIIMS, because it's an old exam, focuses a lot on repeats. If you have done repeats well, if you have done about 10 years of paper, and remember because AIIMS has 2 papers in each year, 10 years of papers means you're doing 20 papers. That's about 4,000 questions. If you've done about 4,000 questions, you will definitely be in the top 500 rank. And to be in the top 100 rank, I think you need to be updated with the latest journals and all. Now, AIIMS tends to focus more on community medicine, lot of statistic questions. At the end of the day, I feel that it's statistics questions and opthal questions which make a difference between the rank. Now, the reason why opthal questions are very tough in AIIMS is because AIIMS, it's to get more AIIMS students back into their institute. That's what was told by the coaching institute I went. AIIMS, they have a separate opthal posting for about 2.5-3 months where they see the most hi-fi cases, and the questions of opthal no one can attempt. It's a fact. So AIIMS, COMET and opthal concentrate, and I still feel that repeats, especially of repeats of final year subjects and in-depth study for the first 2 year subjects matters. PGI. All of us in Johns have heard about the institute thanks to Dr. Saab. But yeah, I mean, it's one of the toughest exams to write. I didn't write PGI exam. I don't think William wrote PGI exam. I personally feel it's a torture to prepare for the PGI exam. But this input has, and the slide, whatever has been on this slide has been told by Randall. Now, Randall cracked the PGI exam after 2 years of bond. He got, I think, 18th rank in the PGI exam, and he was first in the rural bond category. So for PGI exams, you need to have, and this is exactly Randall's words which I'm quoting after speaking with him last night, you need to have 2 to 3 times revision of all 19 subjects. Okay, 2 to 3 times revision of all 19 subjects. Now the reason you need to be thorough with subjects and not just mug MCQ is because of the paper format. The paper has each question, there are 250 questions, each question has 5 options, not the traditional 4, it has 5 options, and it's not choose the best answer. All 5 options may be right, all 5 options may be wrong. So if all 5 options are right, it is you get marks only if you mark all 5 options right. Or if 3 are right and 2 are wrong, you have to be sure on marking the 3 right answers and not marking the other 2. So it has a negative marking. I am not sure what the negative marking is. I think it's 0.25 or 0.3. No, it's not, sorry. So what they do is, the scoring system, I'm really sorry because it changes, and the scoring system is, suppose there are, say, it's 250 into 5 is 1250 options. Okay, the strategy which Randall says is not the amount of questions you answer here, but rather the amount of options you mark. And even on reading many websites and speaking with many toppers, the conclusion is you have to mark about 500 to 650 options, depending on how you feel. So the scoring system that they arrive is that number of correct answers you have marked divided by the number of correct answers which are actually there, minus the number of wrong answers you have marked divided by the number of wrong answers they have done. And then you get a score, and based on the percentile they rank. There was only one instance when there was malpractice in a PGI exam, but generally it's regarded as the very clean exam because the result is declared by the evening. So it does not give much chance for manipulation. I mean, it's a different matter if the question paper leaks and all that stuff. But generally PGI exam is considered to be the most cleanest of exams because the results is declared on that evening. At least your scores are declared and then the ranking is done. So the strategy is on how many options to mark. And the gold standard book for PGI is a book called Manoj Chaudhary book, which has to be read in and out. Now, according to Randall, you need to read that book only after you have thorough with your questions. Because there are some explanations which are given for answers which are completely wrong and useless, and which appear, I mean, you can yourself make out once you read the subject-wise book. So PGI is conducted on the 3rd week of May and 3rd Sunday of May and 3rd week of November. William, you want to tell them about the latest? Okay, so William will just tell you what's going to happen to the AIIMS and PGI exams in the coming this thing. CMC, I think I'll let William speak about CMC.
Okay, I'll just quickly run through it now. As far as I see about the NEET and DNB picture, there is not much you can do about it. This is how it is, and this is how it's going to be. So instead of worrying about what raw score is supposed to get, or what is the strategy which I need to use, all you need to do is study. Because if you are doing well in your other exams, your tests and everything, you will do well in NEET. There are a lot of odd cases where people who have been good enough to do less than 100 in AIIMS and all have suffered in NEET and DNB. Again, out of your hands, don't worry about it. Just study what you're supposed to be studying. That is not going to change. The introduction of NEET pattern does not mean that the books like Mudit Khanna, which were the All India books, or Amit Ashish for AIIMS are out of the picture. These are still going to be your Bibles. Because a lot of questions are picked up indirectly from it. Because the problem which they face is they have to come up with so many questions. It's 300 questions per session. 2 sessions a day. That's 600 questions in a day and around 14 sessions. So you can imagine the load of questions which they have to prepare in order for it to be a competitive examination. So a lot of questions will be nonsensical. What is the speed at which a mosquito flies? I do not care. That does not make me a good doctor. But that is unfortunately one of the questions. And people actually got it right because of luck, guessing, whatever. But the thing was, these questions were there, or also some of the questions like these are there in AIIMS also. People don't cry about it so much, but people tend to cry about it when it comes in NEET exam. So that kind of an attitude where you keep worrying about the system and this is always against me and how am I supposed to do this has to go out of your head. It's an exam, you have to study and you will do well if you're prepared well enough. Same goes for your AIIMS and PJ exams also. One particular point about AIIMS Ophthalm being so tough is because the premier institute of ophthalmology in India is Dr. Rajendra Prasad Institute of Ophthalmology in Delhi, which is where almost everything new happens. So anything new, any case studies, any journals, publications, whatever happens first happens there. What they usually do is they tend to pick up questions from their own journals. So imagine 3 of you come up, see some patient, do a study and come with a formulation and you put a question on that. So anyone from another college or even from some other different batch will not be able to answer it barring you 3. And that's exactly what they do. So they tend to pick up questions from the recently published articles and journals that their college publishes. So it's a big disadvantage for people from outside because we obviously won't do it. We don't have enough time to finish our own syllabus, let alone going to journals. So only and only if by October, November you feel you're in a frame of mind where you're doing consistently well in outside exams and your bhatyas and the test series and everything, do and go and venture on to the journal subjects. Otherwise, do not bother. Because even if you get 1 or 2 questions, you should not be sacrificing on the bulk of your studying from your regular subjects. So try to channelize a little bit more that way your energies, because don't get carried away by important, controversial questions. And there are always big discussions about, oh no, I read this journal and I found this source and this internet source which told me this was the answer and not what was given in the book. Don't worry about it so much. 1 or 2 questions, let it go. Keep your ego out of it. Because a lot of people get carried away and they tend to have big discussions with teachers and professors regarding those 1-2 questions when they're actually giving up a lot of time for regular stuff which you have to read, which has to be done. PGI, one of the biggest reasons why I did not give it because I was based in Kerala doing my bond and I thought it was a big distance to travel. Also, PGI needs a very methodical way of studying. It is not based on repeats. You cannot just mug up questions. It really tests your theory. How much of us can do that can only happen if you've made a conscious decision in your mind, I want to crack PGI. Only then does it happen, because the method and the reading which you have to do is purely theoretical. The emphasis on the MCQs, the old patterns and the new patterns comes down a lot. So that is one of the biggest problems there. As far as the bonders aspect towards all of this, I think it's going to be slightly more difficult because a lot of the responsibilities of work are directly on you, and if you're working in a center which is 24-hour, it also gets a little irritating because you never know when your next patient is going to come. So as regards to, I decide that okay, it's 5, so I'm going to sit and study for 3 years now, it doesn't happen. The moment I hear an auto or a vehicle coming, I just know I have to get up and go. It became so bad that even after I finished my bond and studying at home, a honk I used to get up. Because it just sunk in me that I knew, okay, the patient's come, and again, since it's been recorded, I'm not going to abuse, but it came down to that also at times. So there's nothing much you can do about it again, apart from the fact that it re-emphasizes the fact that you have to plan really well. So whenever you're getting free time, instead of farting around, instead of thinking I'm going to relax a little bit, you study that time. Because you do not know when you're going to get busy. And the next exam, I think, which I found really interesting to give was CMC Vellore. Another exam which I hope somewhere down the line John tries to follow at least. An exam which really makes sure tests the fact whether you have worked or not. Because if you spent your 6 to 8 months purely mugging, you're going to be on the back foot. because a lot of questions are based purely on antibiotic regimes you use. So basically, go to the next question. The questions come like this. It will be a case report. They'll come describing a case. Such and such patient came with such and such fevers, and every examination finding, everything has been given. Then they come step by step. Firstly, you diagnose. Second comes the investigation of choice. Third comes the treatment which you have to give. So if you mess up somewhere right in top, it's gone. That whole stem goes. And they also tend to pick up questions, diseases, something which are very peculiar to the place Tamil Nadu and Vellore. So some of the questions which they ask tend to go above our head. We wouldn't have heard them, but it's very, very common for them. I'll give you an example. One of the questions which they asked was a fever. It was described, and they mentioned cigarette burn butt marks are present on the patient. So I have not heard of that term. And when I went to Vellore for the interviews, I was talking to one of my classmates who was there in Vellore. This is one of the commonest things that they describe for the viral hemorrhagic fevers like leptospira and all, those scabs and everything which you get. And this one, the rickettsial fevers also. So you get those marks. In Vellore, that's how they describe them. But we don't describe it, so we haven't heard about it. So it was a tough question for me, it was an easy question for them. One of the other problems with the Vellore exam is they have very, very good backing for their own students. So they have a huge cutoff which we have to meet, but they have a good weightage for the bond. They have a good weightage for internship in itself. If you have any sort of work experience in Vellore, it counts. So those are some of the challenges that we face when we are writing their exam. However, of what I found, if you concentrate a lot on your micro and pharmac, so when you're reading micro, it shouldn't become repetitive. And I think that's where the second years and third years should really pay attention, because I feel that the culture of PG entrance exam and studying is not at all there in our college. I understand that automuse is coming and it's a big time, everyone has to get drunk and everyone has to enjoy and everything, but the problem is outside colleges people start studying already. So I think it is important that you guys are sensitized at least, so when you're studying you should know that okay, this is why I'm studying, because later on I'm going to use it. It's all about karma, man. If you're not studying right now, it's going to come and bite you in the ass later on. Okay, pretty much.
This is career guidance philosophy lecture.
Just a bit of more information about the CMC exam. I found CMC exam to be the best exam that anyone can set. So just elaborating on what William said, it consists of 240 questions with 1 mark for the right answer and no negatives. So you've got about 160 questions which are straightforward MCQs which you will be able to answer if you've done your other subjects well. Now there are going to be 80 questions which are going to decide between whether you're called for the interview or not. So these 80 questions are, one is this, they're just going to give a one-liner and ask you to choose one answer. Then what comes is a case scenario. Now this case scenario, if you work well enough as an intern and if you work well enough in your bond, you will be able to answer the case scenario. Most of the case scenarios that I encountered, which came in the CMC exam, were the ones which I had seen in St. John's ward. And they tend to focus more on pediatric case scenarios because they are able to get more questions on it. So pediatrics is very important for CMC. A huge chunk, be it the case scenarios or a this thing like this where they give a list of organisms, is focused on microbiology and pharmacology. So you need to know infectious diseases in and out, and there is no better book, trust me, than Park and Park for infectious diseases. It might be the most horrible book in third year, but when you're studying for PG entrance, that's the best book you can have for infectious diseases. Forget PG entrance, even in final year, to cover infectious diseases, Park and Park is the best book to study. If you know Park and Park in and out for infectious diseases, and you know what antibiotic is used for which organism, you'll be able to crack it. And the other one where I screwed up a lot was true or false. Because and even true or false, they asked a lot of pharmacology classification. They asked, like, I think this time there was a question on psychiatric classification, antipsychotics classification, which drug belongs to which group, on autoimmune diseases and all. And like William said, at least 8 to 10 questions were Tamil Nadu words. And in fact, someone had slipped in, I think one of the options was a made-up option, and this was a huge source of laughter in the RXPG forum website, because one of the options had Rajneeism something for one of the poisons, and one more option was Talaivar something. I'm not kidding, it actually happened. Some of the options for 2 forensic questions had Rajnee's name and Talaivar in it. So some of the options are made up, and they use a lot of Tamil words, especially when it comes to forensics. So that's hard. So what William said when he means that there's a lot of weightage is that though the exam is for 240 marks, it is reduced to 60 marks. Okay, though the final evaluation is out of 100, it's reduced to 60 marks. So the entrance exam marks, so suppose I got around 180 on 240, my score on 60 was around 44, 45. And so you're called for the interview. Now they start adding marks. They add about 5 to 10 marks if you're a CMCite who has done the bond. They add about 5 to 10 marks if you've done internship in CMC. They add 5 to 10 marks if you've worked for 1 year in CMC. And the only place and only where one person from Johns might get that extra 5 marks is if he or she has been the best outgoing student. So there is 5 marks for being the best outgoing student, which they add. So based on all this, and it's transparent because they tell you what your pre-interview score is. And then they call you for the interview. The practicals were very spotter-wise, at least William and me both went for radiation oncology, and the practicals were relatively easy, but it was not so for medicine and chest medicine. And then in the interview, they just test your personality and about your general knowledge of the subject. So CMC exam, I feel, is a must-write exam even during internship, because apart from the All India exam, this is one more exam which you're eligible to write during internship. So it's in the month of January, and it's a computer-based exam held in Bangalore itself also. So that is something which is worth writing.
The other thing about, again, so that's why second years and third years, whatever you're reading right now, read it well, because you should remember that when you're studying right now, so if you're studying something like in this area, what at least even I tend to, but I also did during my second year, was just mug it up plainly without understanding what was really going on. And that really gets tested in the Vellore exam, because they'll probably give you real clues which you can see if you've really understood it. So they'll come up with words like chocolate agar and anaerobes and gram negative and all that. So if you don't have the concept, if you're not understanding and studying it, it's going to be a big problem, because you'll have to revise all of this, or you'll have to probably redo all of this in your post-internship phase, and that's a big lag, because the more amount of subjects you've not really read well, the tougher it's going to be. So that is why I feel it is important that all of you all start studying an internship, because the later you start, the later it's going to become for you, even to get in a seat. So when you're studying second year, when you're studying third year, all you need to do is study your subject-wise books really well. So if you're doing your Ananth Narayan the way it's supposed to be done, you're going to be in a good space when you start your internship, because then you can recall much faster. Because I know my first year was really bad. My basics were really, really flawed. And I realized that once I finished first year itself. So I had those guilt pangs whenever I used to be studying medicine, because a part of that physio base was never there. And I think a lot of us have encountered that, because how many of us really understood physio is a question which we need to ask ourselves. So that is what happened to me, was when I started my bond, I had to really, really concentrate on physio, because I knew if I could cover that part, a lot of my medicine was also going to get clear. So you need to identify your weaknesses, and since you guys are studying those subjects right now, make sure that you have as few as weaknesses as possible. Because if you, in final year, if you're doing your books well, if you're doing Davidson, Guy, OB and all really well, you really don't have to stress about them so much. The stress comes in the first year subjects only because it's like really, really far behind. So you don't remember what you've done, and your concepts are not there, biochemistry is a pain, and it's a huge deal that way. So make sure that when you're studying right now, you're studying well enough. And I'm not saying that go hysterical and start buying MCQ books and study only and everything. So whatever you're doing right now, do it well enough so that later does not become a problem. Okay, so that is the other thing. Now coming to the other exams, so probably your calendar is going to look like this. If you're going to finish internship in March, you're going to be out by March endish. June you'll have an exam. November you'll have an exam. November is the key month. So you need to make sure that if your exam is, last year NEET was November 23rd, AIIMS was around November 10th. So you have to stop studying anything new from around September end to October. From that part, it's only revision. Because you cannot keep studying new things and without revising what you've done in the past 4-5 months. Because whatever you've read in those 4-5 months has to be consolidated. So you have to make sure that you read as many new things or whatever you've not understood during those 4-5 months. After that, it's all revision. Because if you revise really well, you will do well. A lot of people have read a lot, but they've read it so far behind, they can't really recollect it. And what a drawback of that is when you see a question and you've heard that term. So I asked you a question about PNH. and you've read it somewhere, but you really don't know what it was. But then when you're writing the exam, you'll be like, oh no, I had read this, so I really can't leave it alone. I will probably go for something here. 9 out of 10 times I'll be wrong. Because the question will be some factual question and you will mess it up. But the thing is, you will find it really, really hard to not write that question only because you know, somewhere I read it, let me mark it, it might be correct. Because you feel that, okay, this will be a better question to answer than something which is absolutely new. So that is why make sure when you're studying it well. Superficial reading is required, but make sure that it's somewhere in your head so that you don't make silly mistakes like this. And negative marks are really, really going to pull you down because it's a competitive examination. It's not what's happening right now. Where you get your 50%, okay, you've passed. So you get 65, okay, first class, and end of story. It's not like that. You might have done the exam really well, but you still might get a seat. And that is one thing which has to go into your systems really, really early. So giving a good exam does not translate into a seat. I quickly move on to the other exams. Around Jan 3rd week is when CMC Vellore happens. November 23rd to December 1st is your NEET window period. After that, there is a lag period in December where usually there are no exams. That is the best time when you reanalyze your studying. How much have you done? What were the subjects you have not read well and where you suffered in your NEET? Make sure that a lot of it is covered before NEET because NEET is just not the All India exam now, it covers the state exams. So that is your one shot to move into a government college. A lot of people talk about, oh, government college is this, the clinic exposure is that and everything. And stipend is so much better than what we get and everything. So make sure that is your one shot. So this feeling that we have, anyways, John's exams in February, I can chill out. That's really, really stupid. And I think it's that is a recipe for disaster. You probably have to be studying for the All India exam as your main exam. Once that goes on, then you reanalyze and see, okay, I did not do Dermat really well, or I did not study Dermat at all, or the other subjects for some physio part again went back. So into that month, you go back again and reread everything that has to be done. Early January are the times when the other deemed university, private universities like Yenagoya and Nitte and KLE and all to give their exams. Whether to write or not, there's a lot of rumors around the mail saying most of the seats are already sold. Maybe, maybe not. None of your business to know. What you need to know is study and give 1 or 2 of those exams so that you're in touch. Because you haven't given an exam after your November 23rd to December 1st week period. And you're kind of rusty for December and early Jan. Write a couple of exams just to get into the groove. Just to make sure that your timings are right. Just to see whether your preparations are on track again. Write those exams so that when the big ones like the Vellore and the Comet K, the Chipmunks come, you're well in place. You've had a trial run with these exams. So even if you don't, because I wrote KLE and I had a horrible experience. I had kind of given up. So in the second year, and I just did not, because it went worse than my NEET. And I realized there was something fundamentally wrong with my studies. So then I had to again revamp and see what was going wrong. And that's when I started again studying what I had not done really well. So again, then you go into your CMC Vellore, then comes the Comet K exam. Comet K exam must do book is the Sure Success Comet K book. Have to do it. Repeats are plentiful. It's a very doable exam. The only problem which comes with it is sometimes it's a little difficult, but the problem is there is a lot of cramping of scores. There are a lot of people. There'll be like some 100 people on 124. And then you move up and you see that the ranks have climbed up by 300. So each and every mistake that you make, your rank is going to deviate. So when you're guessing, if you really don't know anything about it, just leave it alone. But it really makes a difference. It's a different approach of different people. So it's only when you know that if you have slight amount of thing to it, you might want to guess. But if it's absolutely new, you'll have to reconsider because the way the ranks go down is really disheartening because you see that there are only 2-3 marks difference and your rank is just gone all over the place. So
but just one thing here, the Comet K paper does not carry negative marks. Okay, so my approach even when there's negative mark is if you're able to eliminate 2 options out of the 4, go for it because there's a 50% chance of getting it right rather than completely leaving it blank and then coming back and thinking, oh, I should have marked it, I was right. Because even if there's negative marking, it's 0.25, whereas if you mark it right, it's +1. So getting a +1, I feel, is always better even if you lose 0.25. But don't go randomly, haphazardly marking everything helter-skelter. But if you are able to eliminate 2 options out of it, go for it. That would be my thing. And Comet K, by and large, most of the questions are guessable also, if you look at the previous papers. So in exams, especially which don't have negative marking, and if there is, that's why again here, reading the prospectus is important, because they will say what the tiebreaker is. In some exams, the tiebreaker will be the least number of wrong answers. So if the tiebreaker, the first criteria for the tiebreaker is going to be the least number of wrong answers, then be careful in marking things which you don't know. But if there's no such criteria, go ahead and give full vent to your creativity in marking the answers.
I think that by far the rule of 50. So if you can eliminate 2, try to go for it. That's, I think it's quite sensible and common sense.
We'll just stop here. I mean, we'll just put up the books to study later. We'll just throw it out open for the audience now for the questions you want to ask us. Anyone? Yeah, Kushal. Yes. First question. Go on.
There are all these exams, right? Is there any limit on the number of times you can attempt the exam?
As far as All India and the state exams go, there's no limit. I don't think AIMS has a limit. I'm not sure about whether PGI has a limit. CMC does not have any limit.
Even PGI.
Even PGI also does. So no exams you can go on writing it. However, there's an age limit. Okay, and the age limit is about 35 or 36 years. So if any of you, I don't think anyone would not have got a seat by the age of 35, 36 years. This 35, 36 years is basically for those who are working in government service, have a bond of 7-8 years. This 35, 36 years age limit is for that. But otherwise there's no limit to the number of attempts you can give.
Also in places like CMC or Johns,
places like Johns or CMC, does any research papers or anything like that carry any
That's
weightage?
only in the interview session. You have to be called for the interview. Only then what
Only after being called for the interview and only if the paper has been published. Because I was asked to carry a photocopy proof of my paper, and only when I submitted the paper in the interview was, I don't know how much marks was added, but that many marks were added. There are marks added. I'm not sure about the Johns exam. Because Johns exam, there is a, when we fill up the application form, there is a form which says, category which says any research paper publications, and if so, this thing. But I do not know if it's been added or not.
No, having been on the selection panel for RPGs and for the entrance exams, more than 90% of your marks is your theory weightage. The interview is everything else put together. So I think a paper would just add an extra feather to it. I don't think it will carry too much weight of itself.
From what we can tell you about the Johns entrance exam, it's 200 marks. This year, on the day of the exam, they sprang a surprise and said there's a minus 0.25 negative marking. It was not there for the last 3 years. Out of 200, there were some people who attempted only 160 questions and they were not called for the interview. I attempted around 190 questions. 190 questions, and from what we were there during the interview, I think the interview as such carries about 15 marks. Your practical carries about 10 to 15 marks. And then the rural bond, depending on the center you have done, carries 20 marks for A center and 15 marks for the B center. And I'm not sure whether they're giving marks for being a Johnite and Catholic. But essentially you can see that 200 marks constitutes the major chunk. So if you have done well in the entrance exam, you will definitely be called for the interview. And then it depends on how you do in your practicals or not for getting into the seat.
There were a lot of rumors when, especially when I was about to make my decision whether to bond or not. How were the marks going to be given? And this has remained an internal mystery. Even though I've completed my bond, I still don't understand how it works. Whether they reduce the marks to 50% or whether we have to make a cutoff which is set by everyone who writes the exam and then our bond marks are added. There are a lot of discrepancies, a lot of theories, a lot of different people have told me a lot of different things. But again, I'm not here to week into the debate about whether you should bond or not. I think you're smart enough to make their own decision. I think for people who are bonding, for people who are going to bond, I think it's pretty simple for me. Whatever exam it is, you have to study. I mean, how does it really make a difference to you if they're going to add it later or they're going to add it before? If you're going to compromise on your studying, thinking, anyways I'm writing Johns, anyways they're going to give me this weightage, anyways I need to get only 100 out of 200, I'm going to get a seat, it's a really, really stupid thing to do. A lot of people have done this, a lot of people have suffered. So the simple thing, all you need to do is study for All India exam, whether you're bonding, whether you're not bonding. Just study for All India exam, because if you've covered a big chunk by November in itself, you're in a very, very good position come Johns, because you still have 2 months to go, and 2 months is an immense amount of time. That's when your leave kicks in, and that's a lot of other time, you get your more time and everything to read. So if you're studying for All India, you're going to do well. If you're studying only for Johns, if you're going to think that yes, Johns is waiting and they're going to lay down a red carpet for me and I'm going to walk back in because I've done the bond, it's not going to happen. And I'm saying that because I've seen it happen to a lot of people. So I think I do not want at least you guys now to make that decision or that error where you think anyways John's exam is there, anyways if it's July right now, anyways John's exam is in February, 7 months, you'll never start studying. But if you're All India is in November and you're in July, you have to start studying. So make All India as your fulcrum and you put everything around it. So if you're studying well enough for All India, you're going to be in a good space.
There were some questions which came to the email ID and the WhatsApp group, so I'll just try to address them from my experience viewpoint because someone pointedly pointed out that I was seen to be loafing around during the months of July to September, not studying. How did I crack the entrance exams and all? In my opinion, if you do a Google search on how to crack All India exam or interview toppers, which I did also, this is what you will get. 12 hours of study for 9 months. You have to start from January. Books to study, Chaurasia for anatomy, Genong for physiology, Goodman Gilman for pharmacology, and this is there. You just go back, Google today on how to crack All India exam, interview with toppers, this is what they say. 12 hours of study, 9 months a year, last 2 months, 16 hours of study. Okay, so this is what is told in many coaching centers also. But there were 2 people in my coaching center, and I think that all of you must follow that, what I'm going to tell you, be it your final year exams or any exams. That one thing is, all of you are destined to get a PG seat within 3 years. Okay, this was told on the day 1 of coaching center. It was an ortho teacher. He said, all of you are destined to get a PG seat within 3 years. There are 2 things which your effort is going to change, whether you're going to get it in 1 year or 3 years. And going beyond your destiny, you might be destined to get, let's say, microbiology seat, but you want to do anesthesia. So it's your effort that's going to change your destiny. But be assured that you're not going to be in a situation where even after 10 years, you have only MBBS to your name. Within 3 years, and I'll guarantee this to you after seeing even people from 03 and 04 batches, within 3 years, you will get a PG seat. Where, what seat, and within how much frame depends on your effort. The second thing, how many hours of study is required? Okay, different people have different opinions. William's opinion might be different to mine. But even I was in this fix. I was going around asking everyone, how many hours are you studying? How many hours should I be studying? How many hours? Then someone told me I'm studying 14 hours a day. I realized that's not possible. Someone else told me I'm studying only 4 hours a day, but I knew that I should not take it because he has been studying like that for 3 years now. So I didn't want to be in that situation. So at the end of the day, I decided that it's not the hours of study that matters. It's the targets you set. That is what that matters ultimately. Today I need to do 200 questions. Now some days I used to finish that 200 questions within 3 hours. Some days it used to take 5 hours. Today I need to finish pharmacology, autonomic system and cardiovascular system. The most important thing in PG entrance exam is to make a day-to-day plan and sticking to the day-to-day plan. I knew that I was going to be swamped with Golden Jubilee work for the first 2 weeks of August. That is why I decided that before Golden Jubilee, I had to finish physiology and biochemistry for 2 weeks in the month of July. So it's about making a plan for each day. Or for example, tomorrow is Sachin Tendulkar's last match. There's no way I'm going to even touch my book or read it. So today I'm going to spend an extra 2 hours and try to finish 200 more questions. So it's all about making a day-to-day plan and sticking to it. This was the best advice ever given to me by any teacher or any senior, which is it's not the hours of study that matter for PG entrance. There will be many people who will be studying 14 hours, 16 hours, 12 hours, 10 hours. But it's the targets that you set and what you achieve for them. And the other most important point, like William was telling, was it's very important to start preparation in July. Okay. More importantly, I say for the second and third year students and the final year students, don't study now only for getting 50%, 55% in your exams to pass. Study to get about 70%. Because if you have done your UG subjects well, believe me, the amount of time that you spend during PG exam is going to dramatically reduced. I say this from personal experience because I did my second year subjects very well. Third year committee year, I didn't touch my books, and that too only singy till exams. So when PG time came, I could finish Path, Pharmac and Micro in about 8 to 9 days each. Whereas Opthal, ENT and Community Medicine, I had a really hard time. And even now in any entrance exam, to answer Opthal, Community Medicine and ENT, it's a terrible time for me. Whereas if you give me Path, Pharmac, Micro, I just need about 2 days revision to answer them again. So it really depends on how well you do your UG subjects. So that's the bottom line. You need, forget about what everyone tells, and this is for the internship batch and those going to do the bond and those not doing the bond and also studying. You need 6 months of solid effort. And I would say on an average 6 to 8 hours, but more importantly the targets. And I'll tell you 2 things that happened to me. DNB exam which I wrote on about November 16, I got about 7,000 rank. I got 7,000 rank, that was not good enough anywhere. Okay? One and a half weeks later, I wrote my All India exam and I got a top 2,000 rank, and I was eligible for any seat I wanted anywhere, and obviously I was eligible for anesthesia and the surgical specialties in the good colleges. So what happened in this 1.5 weeks? What was the difference for me jumping from a 7,000 rank to a top 2,000 rank? It was not that I studied anything new. It was just the amount of revision. I never revised before my DNB exam. I was distracted by a lot of things because AIMS exam had just finished. So I thought, okay, this is the time to chill out. There was an India-West Indies test match which happened to be Tendulkar's last test match. I just didn't revise for my DNB exam. I thought I have studied for my AIMS exam, that must be good enough for DNB exam. And when I wrote my DNB paper, like William was saying, all the questions were seeming familiar, but I just couldn't figure out the answer. And I could eliminate 2, and I went and marked the wrong answers. Revision plays a key role. Whereas between the time from DNB to All India exam, I revised around the entire Mudit Khanna, Amitashis and DNB Kalam. So in 1.5 weeks, I was able to revise almost about 6,000 to 7,000 questions. And that made the difference. And when I say revise is revision. You just see the question, you think you have already read it. Now is not the time to go see what the answer is. Oh, there is a controversy about it. I need to contact my professors, all that. Revise means read the question, answer, and some important explanations. You come across many grading systems, scoring systems. You just revise them. That's why in 1.5 weeks, you must be able to finish about 6,000 to 7,000 questions.
I think a simple way of doing that, at least something which I used to follow, was after finishing my second reading of every book, at least of the subject-wise books or whatever, MCQ books, what I used to do was if the question is given here, I used to I write the answer right in front of it. This is after my second reading, by the way, so don't start doing it before itself. Write the answer right to the right of the question, do like that, and put a bookmark on it. So when your second reading, when you're doing, you do this. So when you come for your third reading, all you're doing is putting a bookmark on the question, on the answer, reading the question, answering, checking whether it's right or wrong, and going ahead. That is the only way you can do such a lot of questions in such a short time. So this is supposed to be followed before every exam. So if you're doing the DNB exam, there's a column series, volume 1, volume 2, is enormous because the number of questions there are, the fact that there's so many of it, it's really challenging when you look at it. So you can't really expect them to do that like 1 or 2 days before your exam. So all you're doing is question, answer, question, answer. The moment you get a question answer wrong, you quickly go flip back, see, okay, this was where I went wrong, and go ahead. You can't, okay, let me just revise all of this topic again and see which book to see and everything. It's question, answer, question, answer. So even before your Common Key exam, this is what I did. Even before the Common Key exam or where the Karnataka CT which I had, where even the number of repeats were really high. So you have to be really, really thorough with the books. You just cannot afford to miss a repeat when it's coming because you know 9,000 other people are going to get it. Your rank is just automatically going down. So just go to the question, answer, question, answer, question, answer. That book has to be done in half a day. So you have to plan yourself well because you have enough and more other things to read. These are just the repeats. There are obviously new questions also coming down. So you have to get this done really fast. So usually this is what I did during my third reading. So second reading I used to quickly mark it and third reading was question answer, question answer. Just move your bookmark along. So that's the quick way of doing it. That's what I followed. Again, number of hours and how to study and all, it's very subjective because you've probably seen it during UG itself. There are a lot of people who fart around and 2 days before the exam they'll just read something and you'll be studying for 2 weeks or 2 months and you'll probably get half of them. So it works differently for different people, and I think by the time you reach internship, you already figure out how you study and how many hours you need to put in to get that desired result. So that short-term goals is very, very important. Daily, weekly, and then reassessing. So that's when I realized that people who you're with here, the people who are sitting next to you, are not your competition. They're your friends. So make sure that you make plans which you can analyze with someone else. Don't make plans which are really, over the top, which cannot be achieved and feel bad about it. Make plans which are achievable, but don't keep them too slow also. So that is why the other person can pace you over it. So that is what I used to do, because when I was bonding, I was kind of isolated in a village and really far from what was happening around the scene. So what I used to do is, when I used to go to Kottayam for my classes, I used to, after every weekend, I used to sit down Sunday evening with my friends who had paid off the bond and ask them, so what are you going to do this week? And they would tell me, okay, so this is what I have planned out. And I used to at least keep an aim of reaching at least 60 to 70% of what they're doing. There were weeks where I used to just only do 10% because there was so much work going on in the center. But I always knew, okay, so this is how much they've read, I need to be somewhere around. It's almost going to be impossible to do as much as they're doing. It's not possible because they're doing nothing else. So that's where the importance of forming your goals and plans is very important. Because you cannot get carried away in your work and thinking, oh shit, I did 100 questions today, I'm feeling so good about myself. It might be the least amount which you're supposed to do that day. So that is why always talk to people who are paid off or whoever who's bonding and make plans together. So that there is some sort of continuity, so there's some sort of, you know that, okay, someone's also doing this with you. Someone's in the same rut as you were. And that, I'm telling you, you're not getting it right now, you'll get it when you're in that situation. When you see people who are attending classes in third years and they're answering much better than you. The amount of pressure that you feel that time, it's unmatched. Okay? So if there's something else you want to ask, yeah, go ahead.
Must to do coaching or something like that? Keep mentioning classes.
See, I think it's a good question. The only thing which I did my bond, at least I did my bond, so I needed coaching only because I wanted to be in the zone. Because when you're bonding and you're in a Peripheral center, it becomes very easy for you to become very comfortable in your life. If I wanted that time, I could have just done my OP, gone back to sleep, got up, had my tea, seen my evening OP and relaxed. When you're attending coaching, you see other people studying. You see other people answering. You realize, okay, fine, I don't even know what they're talking about. There will be times that you'll actually realize that. And if even then you're not getting the desire to study, then there's probably something wrong with it. But otherwise, so that is the only reason why, one of the biggest reasons why I wanted to do coaching was just to stay in touch. Otherwise, I know people who are doing subjects like radiology right now who've done it without coaching. Who've been sitting in tribal forest area bond centers and now are sitting in the plush AC room of our radiology department. Okay, so the basic thing being, coaching is only there. Second thing, tests. You have to give regular tests. It helps you in analyzing how much you've read. Also, timing. Because, and especially more in the current scenario, because the patterns are changing left, right and center. So if you're sitting in some Peripheral center and you're thinking, oh, I'm going to read Mudit Khanna and go, Mudit Khanna is not what is only required right now. You have to enhance that.
The other thing about coaching is, for people who are not doing the bond, there's always the pressure that you're paid off 6 lakhs and you need to crack a seat within 1 year. I mean, this was the pressure felt by some batchmates of mine. So coaching is a good break from the monotony of sitting at home or wherever you're working part-time, because when you go there you realize that there's a huge spectrum of other people also who are studying like you and are in the same position. I used to sit at the last bench in the coaching center right next to the door, so that if the class gets too boring, I can just walk out. But the aim of the coaching is not more so to learn about the subject, but to know where you stand among the vast spectrum of people. The most important aspect of coaching which I found were the grand test series and the subject-wise series, apart from a few subjects which were taught. Roshni will take and then we'll take another. Yeah, correspondence are...
Just state the question again.
Yeah. So the question which Roshni is asking is, do coaching classes have correspondence course? Yes, they have correspondence course, but the correspondence course, according to me, is useless, because they send you a bunch of material, textbooks, which I'm pretty sure those whoever have gone to, they don't do that. Yeah, no, that's what I'm telling. Because Anne came to me very excitedly during internship, telling, give me your Bhatia notes, Bhatia test material. I just told her one thing. It's got a lot of dust and cobwebs. You'll develop allergic rhinitis to it. The material there is horrendous. Okay? Do not. So there's no point. what you can instead do is to join the test series where they give questions with the explanation, because solving that helps a lot more, because your rank comes. So I wouldn't recommend a correspondence course unless you have no other option, because that material is pretty useless. Instead, what you can instead do rather than the correspondence course is ask your friends who are attending the coaching course the notes that they make, which is most important. I was too lazy to make notes in class, so I used to take photocopies of my friends who are attending. Ask them to send a photocopy, and whatever you're paying for the correspondence course, pay for the photocopy and the postal charges.
I think better than the correspondence course will be joining an online test series. Because instead of, if you're in an outreach center, it's not always be possible for you to go to the centers. And because in Kottayam, where I was there, they had Monday tests. It's impossible for me to get out on Monday. So what I used to do is, I used to join an online test series. All the questions get uploaded with the answers. You can access them whenever you feel like. So I think that will be much better, this thing. Plus doing your subject-wise books and all these tests will be enough.
Another.
Which is better, like joining the weekend classes or the daily coaching
So
classes?
please do not, at least it's my opinion, that do not join the daily coaching classes. I mean, I would still suggest that whoever, I mean, it's a personal thing, that even if you're paid off the bond, try to work in some place, because otherwise, at least I found it increasingly frustrating for the first 1 month when I was not working in SJRI to be just sitting and mugging, and it was hampering my studies actually. Whereas if you're working in a place for about 4 to 6 hours and then you come back, you're fresh, you're in touch with the subject, you're in touch with the outside world, I found that my studies improved on the days I worked rather than the days I didn't. Don't even go for weekday classes, because you need some days to study on yourself. Because let me tell you one more thing, these coaching classes, especially on weekends, are for 12 hours, 14 hours. I have no idea how people manage to sit there for the entire time, even with their eyes wide open. I used to find it a real struggle to sit for 8 hours, but there were people sitting and making notes for 12, 14 hours. So imagine doing that for 7 days a week. I think that would be stupidity, because you wouldn't get enough time to study for yourself.
I think it's very subjective. I know a lot of people who've done weekday classes and got 200 knowledge. So it totally depends how you work. So it is going to be very tough for me to come and say you study 6 hours, but you study 8 hours. I can't.
So again, it's not the number of hours.
Exactly, because I don't know how you study, I don't know how he studies. So that's for you to figure out whether you can see. There are a lot of people I know who could not at all pay attention for 12 to 14 hours. For them, those classes are becoming a waste. So for them, having a 3-hour session daily was the touch of the outside world which Nitin was talking about, instead of working. So it's very subjective. So you need to figure that out for yourself as to regard whether can you concentrate for 12 hours in a coaching class. Can you? And the thing is, sometimes if you give yourself too many options, you tend to become a little lazy. If I say you have to, you don't have a choice. That is the choice which I had to face, because when I was there, I could not go for daily classes. So I knew this is the time which I need to pay attention for. Whether I've travelled and come, or that becomes secondary. The other thing becoming is you need to just make your own plans for it. So if you have, see, the thing is, even when these weekend classes, they have to finish your syllabus in 6 months. Okay, that does not happen with weekday classes at all. It's impossible, because your coaching will start by March, Aprilish. They have to finish by October end, because November you have exams. That's around 6.5 months. And if you calculate the number of weekends, how are they going to finish? So it's not going to happen. They will have weekday classes. So it gets filtered on either side. So I think you need to just figure out, this is what I'm doing. So I'm attending weekend classes. I have to make use of the 5 days which I have. It works different, because a lot of people tire out in those 5 days. Their effect, productivity comes down, because by the time you reach Friday, you're like, okay, I need a break. It comes like that. So that is when you try doing some simpler subjects or doing a couple of tests. That is how you can, replan your things. Don't worry too much about it. That is not going to make a difference in your
rank or score.
Effective.
It really depends on what you want. Any other questions?
If I have to put in my 2 paisa at this point, the biggest danger are the guys who think they're doing very well in JOHNS, the ones who got their distinctions and the marks, because I've been through that journey. I've written all of those exams these guys wrote off. I didn't qualify in any of them. When you're studying in JOHNS, you tend to get the feeling that, okay, I'm good at this, I'm sure I can manage these exams. Bottom line, what they're saying, which was true 15 years ago, is time spent studying. More than anything else, it's just time spent with that book. It's donkey's work. All the guys who cracked AIMS and PGI at that time and even now, the guys who are putting aside their life, sitting and doing donkey's work. Just read, repeat, and stuff like that. Let's take some more questions from the back there, because it will finish with the next 2 slides. Let's take some more questions. ones at the back who are still awake.
Okay, I received one.
Yeah, Anne's got a question.
Okay, I don't know whether it was from their batch, but it's obviously a batch which has written some of the entrance exams. So I'll just illustrate that with a slide here. So the question was about controversial questions. So some of the controversial questions. So I'll tell you why I have put this up to illustrate what a controversial question is. So in NEET or AIMS, for example, you get a question like say identify who this is. Okay, and the options will be something like A, pediatric surgeon, B, alumni career guidance secretary, C, a Mad man, or D, a Popol winner with a special trivia attached to it. So which would you pick as the right answer for this question? There's no all of the above. You have to just mark one answer. And come on, you have written entrance exams, you know there's no all of the above. So this is what a controversial question would generally be like. Or for example, some other time if they ask identify who this is, the options might be A, sparrow, B, a dermatologist, C, balding with less hair, D, alumni vice president. So sometime the answer might be, I might have to change option D, but that's later. But anyways, the answer to this question might be none of the above. So what do you do in such scenarios? So that is what a controversial question is. And like William was speaking, there are some people who literally fit the criteria of hysteria for these questions. They spend about 3-4 days trying to find the right answer for this question when in fact the question might be a dummy question. AIMS and PGI are known to put in dummy questions where there is either no right answer or all the answers are right. So if the paper is having negative marking, it's best not to attempt, and more importantly, do not waste your time studying on these controversial questions. The other most important thing was the email that I received was that there are many questions that your English knowledge becomes important. Okay, and one question and on the John Knight Academic WhatsApp group, it was beautifully explained by Dr. Robert Anthony. No coaching center, no book has given the right answer, but we marked, the people who were on that group marked what Sir said in the WhatsApp group, and it came to me. And it was right, it was right. So the question was this: when do you treat cryptorchidism? Okay, the question is, what is the best age for treating cryptorchidism? Okay, and the options are 6 months, 1 year, 1.5 years, and 2 years. Okay, now one book is giving the answer as 1 year, another book has 6 months, and another book has 1.5 years. Coaching center is telling 1 year. Okay, but Sir just made 2 statements, and we follow that statement even now for any entrance exam. Cryptorchidism is best treated at the age of 6 months. Okay, but it must be treated before 1.5 years. So you see, there is a difference in the words. In 1 year, the question that came was, what is the best age to treat? So when the term best has come, you mark the answer 6 months. Whereas when the term question is, what is the age before which you must treat cryptorchidism, mark 1.5 years. I hope I'm right. So yeah, so you must mark 1.5 years. Similarly, they'll ask, what is the gold standard test for diagnosing pulmonary embolism? Okay, and in one book the answer is given as CT pulmonary, CTPA, and in the other book it's given as pulmonary angiogram. The gold standard is, the answer would be pulmonary angiogram. But if they ask the question as to what is the best test, now best would mean that it is cheap, it is not invasive, it does not cause much complications, then you have to mark CT pulmonary angiogram. But gold standard is the definitive proof and test. So be very, very attentive to the question and each and every word, because that's going to decide whether it's going to be the right answer or the wrong answer. So these are some things which you will develop when you start solving MCQs on your own. Any other questions? Jose. Royson. Royson had a lot of questions.
I'll ask a very offbeat question. You spoke about the AIPG being 60 to 70% paraclinical and preclinical subjects, the emphasis on these things. So if you had to take step 1 as an exam, after which exam would you put it in your timeline?
According to me, at least, mixing 2 things is never a good idea. To mix Indian entrance exams and USMLE, because I used to discuss with Chang some of the USMLE questions, and the USMLE questions are in no way can be compared with the NEET questions.
Because one of the books that you suggested was First Aid.
The First Aid you use for First Aid is for the solving AIMS paper, not the All India. So if you're, and I mean, no person who is preparing for Indian entrance exams will prepare only for AIMS, only for PGI. AIMS has more or less moving into a pattern where they are giving USMLE-like questions. So it's okay to use a USMLE book to prepare for AIMS, but to use an Indian book, study Indian book and prepare for USMLE is completely not happening. The ideal time as such to write USMLE step 1, like they do in other colleges, is after your second year. That's the ideal time. But mixing it now would really be not the best of ideas, but it's very subjective.
See, also because the point which you make about First Aid has become like a supplementary to studying Indian entrances, because the questions are going so hi-fi that every student trying to get an edge over the other student, because everyone reads Mudukana, everyone reads across. So if I read another book, get some extra information out of it, I'm going to be a better level than you. Also, why First Aid became so popular was because of the image questions coming into the NEET and DMB pattern. A lot of the pictures, the slides came straight from First Aid, put onto our question papers. So that is how First Aid got introduced.
And the other thing is mnemonics. First Aid gives a lot of mnemonics which you don't find in the Indian entrance exam books. So it was only for this reason that First Aid can be used as a supplement for Indian entrance exams. But otherwise, to use it as a yardstick to say that let's me plan step 1 along with Indian entrance exam would not be the best idea, at least according to me.
I think I kind of agree with Nitin there, because it's a different ball game altogether. Also because unlike DNB and NEET, which you can give as many times as you want, USMLE step 1, if it goes bad once, that score's stuck to you for life. So I don't think, and you're paying so much money and you're working towards a goal, so you probably have to define that goal one step before and go all out on it, because keeping your leg in both might be a little tricky, because All India is not exactly a piece of cake anymore. It's becoming really, really difficult. So you have to channelize all your energies towards one. You decide which one.
And you will have sessions like this, you will have people talking, but I believe it's about the mindset. You know, even I spoke, William spoke, we told, even if you miss one question, your mark comes down by 300 ranks, it will come down, 900 people will be. And so when you go to the exam, you will go in with a mind frame, I should not get it wrong. If I make this mistake, my rank is going to drop by 600. Some of the exams which I wrote for fun were the exams that I did better because I didn't have this mindset. Don't go in with the mindset that, or even when you come out with an exam, and those of us who have the bad habit of recalling questions and answers will be like, oh, I made that mistake, oh, the one which I guessed I got it right, but the one which I knew I messed up. Don't do that, please, because in the end I believe that over 200 questions, it all equals out. It in a way comes down a bit to destiny and your frame of mind at that point of time. So don't keep on harping about or even listening to people like us saying that 1 mark is going to bring down your rank by 500, 600, so I made 3 mistakes, I'm gone. In the end, it all evens out, because even the others who are writing are human beings. Even they would have made some mistakes in some question, even we would have made. So don't go in with that negative mindset. Any other question?
Can you tell us more about the rural service thing, the PGI?
Rural service thing,
I think of what I know, PGI recognizes all primary health centers. So none of our bond centers fit that criteria. There is a set of guidelines which say the population of the place where you're working should be less than so and so. There should be no other hospital in the nearby surrounding in a particular kilometer zone. The other thing being is, wherever you work, you have to get a letter from the district medical officer. And see, the thing is, some of our centers do fit into the criteria of the population and the other hospitals being around. But getting the letter from a district medical officer is very, very difficult, because it's a government office and they're not there to work for you. So you have to go approach, meet a lot of people. It's doable. Randall did it, but you have to work a lot for it.
I asked Randall the same question yesterday when I called him up, and he said it's very simple. There's a 5% of the PGI seats are reserved for the something called the rural bond quota. Now this can be from any subject and they rotate it every 6 months. But traditionally it's based on medicine, surgery, or now it might not be there, but medicine, surgery, ortho, anesthesia, radio at times. So it changes every 6 months, and it very clearly states that it must be a village of population 5,000 working in a center which has, I think it also mentions you need to be, but it mentions that it can be government service or private practice. You can even be working for an NGO in an area which satisfies the criteria of what PGI calls rural. And then you're classified among the rural bonders. So Randall, even though his overall rank was 18, among the rural doctors, his rank was 1. So the center you work, the area in which you work in must satisfy the criteria of being a rural area.
And the thing is, you can start working on this certificate only after you finish your bond. So the thing is, when I had actually thought about this, and I had done a lot of running around and spoken to some Johnites in Kottayam, and I had one of my eyes on this because I thought if I'm not getting this time around, at least for the May session PGI, if I have the certificate, it's going to do a lot of work for me. So, but the thing, what happened was when I finished my bond, Johns was happening and the other entrance exams were happening. So I thought it was better for me to concentrate on those exams that time. So I kind of forgot about that. So that is why post-bond, you have to spend a lot of time on it. That is one of the biggest disadvantages come. Or you should be okay with dropping that 4-5 months and channelizing all your energies for the next session of May PGI. So that is one of the biggest drawbacks. But if it clicks, then you hit the jackpot. So because you are kind of destined for a really, really good seat in that one of the top institutes of the country. So you'll have to figure out the criteria that's given on the website. It's very well defined. Find out whether a center fits in it, and then work accordingly.
The other thing, that's entirely a whole new gamut of topic, which I had a great difficulty with, and Dr. Robert had solved it for me, is do you just choose a seat because you have got it at one of the top institutes? Because I had a really bad time deciding about it, to decide between CMC and Johns, and ultimately, just remember one thing, and this is what Sir also told me. The moment you choose a subject, you're stuck with it for your entire life. So you must be comfortable doing this because this is what you're essentially going to be doing for the next 30-35 years of your life. So always go for the subject rather than the institute would be my viewpoint. Unless it's two good institutes and it's the same subject, you obviously go for the better institute. But if it's some subject which you're not very comfortable with and another subject which you're getting in a decent institute, I would say go for the subject that you love and then in a decent institute.
I think this is something which you should remember when you're studying also, because unlike when you're studying for UG where when you all came to check your ranks, John's list was put up, we really didn't care where our names were as long as it was in that 60. But now the game changes. Here you're looking at the top ranks because you're not going to get your seats in good colleges if your ranks are not there. It really doesn't make a difference like what you put up, 27,000 qualified for NEET. So what? Only 1,800 are getting the seats. And that too, a lot of them are in widespread areas where we wouldn't want to go. So that is why it becomes even more difficult. So you have to understand the enormity of the situation and work accordingly. This is perhaps one of the most difficult times that you're going to have in your life. And if you're not studying, when you're studying, you should feel, okay, I've never studied like this in my life. That's how it's going to be. Because this is a really challenging phase, but it's a very doable phase. Provided, like Sir said, I remember Dr. Vagish also telling me once from endocrine, he was saying, a donkey can do medicine. It does not really require brains, all it requires is commitment. And I've actually remembered this and carried this with me all my life. Because whenever I felt dejected when I see other people doing it, I know that if I keep going back to my books and studying again, one day it's going to come out. And it did. So I think that kind of applies to everyone. And so even though, when you talk about astrophysics and engineering, you're actually kind of looking at your brains that time. How much can you analyze? How much is your IQ? How much of it can you use? But in medicine, it's not like that. It's all and all your commitment. How badly you want it, that's kind of sets your time period.
Just to end on it, the reason I put this slide picture is because Sir was playing the role of Shah Rukh Khan giving the 70-minute inspirational speech. So just to end this session, just adding on to what William has told, enjoy your UG days. I really don't think that a PG preparation needs to start from third year or final year. You need to read your UG books well with a view to understand the subject, have autumn news, do whatever you do in the hostels, near the canteen, whatever. But enjoy your life as UG days, but study well so that you have a good grasp about the subject.
Some reason why you left out girls block?
So near the canteen.
Near the canteen. I mentioned near the canteen.
Diplomatic.
Yeah, diplomatic. It's being recorded. So but anyways, what I want to say is study your subjects well, but then after that when you come to this phase of preparing for PG, when either if you're doing the bond or not doing the bond, just remember that 6 months of commitment and effort can prevent you from sitting back and studying for 1 year. Forget about what the system is, what the number of seats are, what kind of questions you'll get, which day of NEET you're going to write, whether you're getting those extra marks or not. Just put in good solid effort, and like I said, all of you are destined to get a PG seat within 3 years. I really believe it. When you get it, where you get it, and what you get is left entirely to you. So with that, I think we'll close this session, and if you have any doubts, you can email it to sjmcaacg@gmail.com, or you can message me or William or Sir. And we are planning on bringing out a brochure, sort of a PDF brochure or a PowerPoint, which encapsulates all these points, the dates, the books to study, because I put up the book slides. I just run it for about 2 more minutes. You can just note down if you want.
No, we'll put this up on the
when
we upload this talk. We'll have these list of books there and stuff, so don't need to reach for this thing. So before I thank you guys, I'll call the Vice President to come and thank you guys. But I think we need to thank a team which is standing there at the back, which has put in a lot of hard work for today and for the previous talk. This is Dr. Leena and his team, and Dr. Tony Raj, who's they've been the backbone of the tough end of this job. And they're the ones who will take it forward as well with the uploading and things. So thank you guys. It was wonderful. I call on Vice President Sparrow to say a word of thanks.
The only thing I've got to say is that if we had this talk before the World Cup started, my Castrol predictor line could not have been 15,000 plus. So it's like a very interesting talk. In our days, we didn't have these kind of talks, correct me if I'm wrong, Robert, and we did our own stuff, It was probably, we had much fewer colleges then. You guys have much more colleges now, so I guess somewhere down the line it pays itself. We're happy as an alumni association to bring these kind of talks to you. We'd like to know from the younger Johnites going forward in the next couple of years, what else we could as alumni do for you. Okay? We all know when you go to the US, you want to know which of my friends is down there and meet him and that sort of stuff. But regular jokes aside, on the ground, we'd like to know if such talks are useful to you and how we can go forward, what more we can do for you going forward. Thank you all for attending. This is probably the biggest, the most well-attended talk, bigger than even the US talk, if I'm right? Yeah, thank you very much. Give yourselves a big hand and all the best in the future.
I find a very deafening silence on that WhatsApp group for the career guidance. And most of you are on that, or your class steps on it. Any comments you have, any future topics you want, do you have any thoughts now on other talks that you want to address? From your side, if you can't think of it now, just put it on that WhatsApp group or send it to your class set. Your class set is on WhatsApp.
Personally, I think there should be a talk for bonders before they start the bond. Before they start the bond, they should know what they're getting into.
Okay,
fine.
To help them make that decision. Because I think that there is a lot of groupism which happens. Yeah. He's paying off the student, I'm also paying. So there is no thinking behind why am I paying off the bond or which one is better for me. So I think I'm not going to, I don't want to peek into the debate again that this is good or that is bad. But all I want is people should make an informed decision. So I know what I'm getting into when I start.
That's very good. I'll get both sides of the table to talk. Okay, so anything else you guys think of, send it to your class. You don't have to remember our emails. The email is very straightforward. SJMC for St. John's, AA for Alumni Association, CG for Career Guidance. It's SJMCAACG@gmail.com. Alright?
In all likelihood, Robert's going to be the career guidance secretary for the next 2 years. So I would suggest the one thing that you put forward right now is the next session he has, Jolly will give you a coffee and snacks.
Coffee was on the table today, but
alright, cheers.
We've been sponsored by the president.
Thanks.
Thank these young men, he says. Nitin, you need to do more than put your photograph up there. Okay, alright. Nitin and William, thank you very much. And we hope you